The Rutherford County community mourns the death of longtime State Trooper John Horton.
He and a driver were outside their vehicles at a traffic stop when a cruiser driven by Horton's brother accidentally hit them. Both men later died. It happened last night in southeast part of Rutherford County, that's near the Cleveland County line. News 13's Karen Wynn has reaction to the traffic stop that turned tragic.
James Lovelace lives across the street from where the accident happened. He said last night he heard a loud bang, then the sirens, and today he is grieving the loss of a good friend. Lovelace put a small cross at the accident site on the corner of Shoals Church Road and Goods Grove Church Road. He and other neighbors remember Trooper John Horton, a 15-year veteran, married, father of 6.
He was a godly man. Every time we talked, that's what we talked about. God and the Bible.
According to the State Highway Patrol, Trooper Horton was making a traffic stop just before 9 last night. His brother, Trooper James Horton, known as Nick, responded to help out. James Horton lost control of his vehicle, crashing into his older brother and the motorist, killing them both. The Highway Patrol has identified that motorist as Dusty Luke Beck.
John was a family-oriented guy, Christian-going guy, and very dedicated to what he done, and he'll be highly missed.
No word yet on why Trooper Horton detained Beck or why his brother was called to help him out. The accident remains under investigation. Lovelace also wants everyone to remember Trooper Nick, who suffered minor injuries, saying this is devastating and he could certainly use everybody's prayers. Now, a fundraiser has been set up to help out Trooper Horton's family. You can get that information on our website, WLOS.com.
And every second matters in an emergency, but with a rise in COVID patients, space is running out in hospitals for other people needing help.
As News 13's Rex Hodge reports, that has a trickle-down impact on emergency services.
Hospital leaders say the spike in COVID cases also raises the stress on hospital capacities.
We're still seeing the strain on the healthcare system that we were seeing prior to the holidays, but it's definitely more profound now.
Haywood County's health director is keeping a keen eye on the trend.
When we hear diversion, what does that mean?
Diversion for EMS, that comes from hospitals. Hospitals have increased surge or they're literally full to capacity as far as their staffing capabilities.
Emergency Services Director Travis Donaldson says ambulance crews are beginning to see issues in our mountain hospitals.
If you or your family member comes into the hospital, needs admitted, and there's no beds to take care of you in the ICU or a PCU or up on a floor, that patient gets held in the ER.
And sometimes, Donaldson says, long waits on the ambulance, delaying EMS crews' ability to respond to the next 911 call. He says when out-of-county diversion comes into play, hospitals are focusing on their individual counties to limit an influx of patients.
If one's on diversion, one's not, guess what? That hospital that's not on diversion is going to get overwhelmed.
His crews are transporting patients farther away, even as far as Charlotte, adding to the strain on the system.
Because then that truck is gone for additional time.
A statement from Duke LifePoint's Haywood and Harris hospitals reads, when capacity cannot be internally managed, a hospital may go into temporary diversion status for certain inpatient units and will notify local EMS that it is temporarily at capacity and cannot admit new patients to affected units. Hospital capacity is incredibly fluid and changes rapidly, but we have adequate resources and staff at this time. But Haywood's medical director says going to the hospital now, expect delays.
The mission is still taking the critically ill and injured. For everybody else, you're going to go to your local hospital and you're going to wait.
Donaldson is appealing to the public to help by first, if possible, going to your doctor or urgent cares before going to the ER.
And the hospitals are asking the public to help stop the spread by getting vaccinated, wearing masks, social distancing, and limiting exposure.
Buncombe County leaders have decided to extend the countywide mask mandate through February 16th.
Health leaders say we are seeing alarming new case numbers locally because of the Omicron variant.
News 13's Andrew James explains the impact on our hospitals.
That vote to extend the mask mandate came after a recommendation from the public health director, and with cases and hospitalizations increasing, local health leaders say we must continue to mask up.
I wish I was bringing you good news for this new year. But unfortunately, in terms of our local metrics, there's not much good news to share.
Buncombe County Public Health Director Stacy Saunders delivering a concerning COVID-19 report to Buncombe County commissioners during their first meeting in the new year. She says local case rates are skyrocketing.
As of yesterday, we were experiencing 654 new cases per 100,000 per week. This is a tremendous increase from the last month when our rate was around 200 new cases per 100,000.
The percent positivity is now up to 13.7%. That's up from 6.6% just 1 month ago.
This surge appears to be dwarfing any of those of the January 2021 and the Delta surges in comparison. It's also happening very quickly and spreading very rapidly.
And more cases means more hospitalizations.
The transmissibility of Omicron is really unbelievable.
Hospitalizations are now inching closer to 10% of inpatient beds being filled with COVID-19 patients. But one bright spot, Dr. Bill Hathaway, Chief Medical Officer at Mission Health, says it appears while the Omicron variant is more transmissible, it also seems to be less severe.
If it had been as virulent as Delta or any of the other strains, we would be overwhelmed with hospitalizations right now.
And we know how hard it's been to find at-home test kits locally. Stacy Saunders says they are ordering test kits for community distribution. Those test kits could be here as early as next week.